Hi there, it's Jake from Primal Revolution, and today we've had someone contact us about lower back pain. So I had a little bit of chat to them about their symptoms. They've been getting pain bending forwards, pain on the PSIS, the bony bit just at the back of your pelvis, pain from getting from sitting to standing, sitting for long periods, standing for long periods, a little bit of pain on walking. Now this to me sounds a little bit like SIJ problem. So sacroiliac joint, which is the joint where your pelvis meets your spine. Now as a bit of a disclaimer before we get too in depth into this video, I would suggest that you always go and see a therapist and get a proper diagnosis before you start really attempting any of these exercises, because I don't want to send you away and aggravate any of your symptoms. But that being said, if you know that you do have a SIJ problem, or if you just want to give it a little bit of a go to see if it gives you a little bit of relief, go right ahead. So, a little bit of a discussion about what happens with an SIJ problem. So often I see people that either have hyper or hypomobility, so that is your pelvis not moving enough or moving too much, and it can get stuck in a poor position, and then you get inflammation, spasm in the muscles around the area, and which is what leads to your pain. So a few little tips for you if you are experiencing this problem. One exercise that we want to do is to start to mobilise that pelvis again. So the first way I'd suggest you do that is passively. So laying on your back. I'm a little bit stiff today, having done quite a big leg session for the last few days. So what we're going to do, placing one hand on one side of your knee, the other hand on the other side of your knee. What we're going to do is a bit of a push and pull with your hands, and you're going to resist that with your legs. So what's happening at your pelvis here is you're getting a bit of a shift from one side to the other, and that just keeps your pelvis nice and mobile. So in cases where it is stiff or stuck in a poor position, this just keeps it nice and mobile and should help reduce some of your pain. So what you're going to do is you're going to push for 5 seconds, hold that, and then relax, swap over, push and pull for 5 seconds, relax, and you're going to repeat that 10 times. So all of the exercises that I'm going to show you, you want to sort of repeat a few times throughout the day. Next exercise, we want to start to move it a little bit more actively. So I would want you to, this is another video we've done about the squat, we've shown you this one before, so we're going to do some pelvic tucks. So what I want you to do is to tilt your pelvis backwards and tuck it underneath you. So 10-20 repetitions. As a bit of a disclaimer for this one, the end range of movement can often be quite painful for people. So with this one, we want to only move in a pain-free range. So if that means you're only doing a tiny range of movement, that's absolutely fine. You just want to keep it nice and mobile. The next exercise is your salsa hips. So shifting, straightening one leg, shifting that side of your pelvis up. Again, if you are experiencing pain when you do this, try reducing the range of movement first. If that's still aggravating it, I'd leave it alone. The last exercise I'm going to show you is for your glutes. So if you have back pain, bending forwards is quite strenuous for the muscles in your lower back. They're in their eccentric phase of the movement, so they're essentially in their longest, weakest position, and they have to hold all your body weight up against gravity. So if we can loosen off your glutes, so you can hinge from your hips a little bit more, often that gives you quite a bit of relief. So grab yourself a tennis ball, lacrosse ball, cricket ball, spiky ball, you name it. You want it to be about a tennis ball sized ball. And what we're going to do is we're going to place that, I'll show you in a second, but we're going to go just underneath your pelvis. So in this section around here, you're going to lay on your back, you're going to place the ball in your glutes in this sort of area around here. So find a place where you really don't want the ball, and that's where you want the ball. So for me, then I want you to do straighten out your leg and bend it up to your chest, and find the area which is most uncomfortable. So for me, it's around about here. So then in this position, I'm going to drop my knee out to the side and bring it back in. So I'm going to repeat this a few times until that starts to ease off. So all you're looking for with this exercise is a change. It's never gonna feel comfortable. You've got a ball pressing into a tight muscle, but you're looking for the movement to get a bit easier, that sort of pain that you're experiencing not to be quite as sharp. Once you've got a change the position of the ball and repeat that a few times, and you should find that your glutes have loosened off and bending forward should be much easier then. A few other things that can help you out with SIJ problems. I often find that people respond best to heat. It allows the muscles to relax. So a hot water bottle, a wheat bag, hot shower, hot bath, placed on either your glutes or your lower back can often ease things. If you find that it is aggravating it, obviously leave it alone. Other things that can help. I would suggest not being stuck in a position for a prolonged period of time, so regularly moving. So I wouldn't stay in a position for more than sort of 15-20 minutes. So I would standing, sitting, always get up, have a little bit of a wander every so often, and that should reduce the amount of pain that you are experiencing. Again, I'd always go and recommend you go and see somebody and get it checked out properly, because there's a few other things that can hide themselves as similar symptoms to what I've suggested. If you have any questions for us or any queries, you can contact us on some of the links below this video, and we will see you soon. All the best.